everyone, this is Dr. Ratna. I get in my daily practice I get various females from various age group suffering from irregular menstruation. So today I am going to talk about irregular menstruation. Before we go to understand what is irregular menstruation, let us know what is the normal cycle of menstruation. See, the normal cycle the cycle is about on an average 28 days cycle and varying between 21 to 35 days, which is also a normal period of the cycle. The period lasts basically from 3 to 5 days and subtle variations are normal. When can you call your period to be irregular? When you have the period very earlier, like before 21 days of your previous cycle, or when you have a period which is late, like delayed after 35 days of the cycle, it is called to be an irregular period. Even if you are having the flow is lighter or excessively heavy bleeding, it is also called as a irregular periods. Anything which is abnormal from your previous few cycles is called as irregular period. So what are the causes to cause these irregularities in your period? Initially, when the girl gets menarche, so the period will be irregular so that her hormones are balancing in her body, and when the lady is going through the menopause, again the periods are irregular because there is little bit of slight hormonal fluctuations which are considered the normal thing. And every woman in her lifetime undergoes the irregularities in her period from time to time, which is normal. But when you suffer from the irregularity for the longer duration, then there are certain causes which you should take and cure them. The first cause is the stress. We do have various kinds of stress, work related, relation related, or studies. So these are the kind of a stress which may cause the irregularity in our cycles. Diet, if we are consuming more junk food, less nutritive, empty calories, then that will cause us the irregularities. Exercise, if you are not doing any exercise or if you are overdoing your exercises, irregularity will be there. And the hormonal fluctuations like in PCOS, that is polycystic ovarian syndrome, where you get the delayed cycle because you are not ovulating every cycle. So there is an irregularity in your period. Or thyroid dysfunction, where your thyroid is not functioning properly, and if you have a anemia, that is low hemoglobin, you will be suffering with the irregularity of your periods. How do you deal with it? See, in Ayurveda, we consider each person as a unique entity. So the treatment is based on one's own body type and impairment or the irregularities in their body, what we call as a vikriti or imbalances. So the first thing, whatever it is, the first thing is you should eat nutritive and balanced diet. Second is de-stress yourself. There are various ways to de-stress. Find a suitable way where you can de-stress yourself and do that. The third is, if you are suffering from the hormonal fluctuations, serious irregularities connected with PCOS or thyroid dysfunction, obesity, weight gain or weight loss, low iron content, then it is better to take the remedies to heal yourself and cure yourself. There are complex pharmacological formations or formulations which will help you. There are herbs like shatavari, ashoka, lodra, manjishta. The combination of these herbs will help you to cure your irregularities and have a regular cycles. I am conducting a free workshop on irregular menstruations, where you will learn more about causes and remedies in detail at our clinic on Monday, 10th December, that is 11 AM to 12 PM. Register yourself as limited seats are available.